Hello, TS. Hello, my Facebook family. It's a new day, and admittedly, today I thought we were done. It was supposed to be a three-part series, but some new information came out. There's some data points that need to be highlighted, as well as many people have reached out to me with the same questions. So we decided to do a part four of this series. Again, a part four of this series. I'm sure many of you all have heard about the newest data, and it's big. It's something to weigh in there. So we're going to do this in our typical format, which is for the first 3 to 4 minutes, just say hello to people. Then we're going to go over the new data, and then I may quickly run through parts 1, 2, and 3. And I just want to set it up for everybody. Again, this is not going to be an easy decision for anyone who has to decide whether or not they're going to go back to whether their kids are going to go back to school. But what it can be an informed decision. Again, it can be an informed decision. And please, hey, Gigi, what's going on? Hey, drop in the comment section where you are listening from. Drop in the comment section where you are listening from. And I'm sure that everyone's amazed that we are at this juncture of COVID and the number of deaths. The good news is that there's some information that's coming out that a vaccine may actually be ready come January. And we're going to have a full live about that. We're going to really have to talk about what that means. And if you think about it, we're all in a difficult position. Why? Because I've always shared with you that since February, when we started to rock together, that my information comes from peer-reviewed journals, a listserv of doctors that I'm on with nationally, clinical experience, the CDC, WHO, and Dr. Fauci. The reason why that stands out is because if you see what's going on in the media in this minimizing Dr. Fauci, the long-term effect is going to be when the vaccination comes out, they're going to need someone to endorse it. And if they've already minimized Dr. Fauci, then Dr. Fauci comes and endorses it. It just gets crazy. But hey, that's not why we're here. Let's jump on this. Hey, I got Gigi. I got Milton in North Carolina. North Carolina is still a little bit of a hot spot. We have to fix that. Gigi's saying they're sending us back to school, and they're not sending my son. We live in the RVA. Now, we've got to be honest here, everyone. At the end of the day, they're your kids. And you've got to make the executive decision for if you're going to send them back. Again, you have to make the executive decision if you're going to send them back. And by the way, let me just, I finally have my copies as well. The reason why I highlight that is that in that book, it teaches executives how to make split-second decisions. As a result of COVID, we delayed the release because we knew that family members are now executives, or even they are executives within their household. And this time last year, most of the decisions that we made about our family were not life and death. All of a sudden, we are in a different spot. Let me set this up for you. And you've heard this, but you got to hear it again. Follow me. We make about 35,000 decisions every day. Most of those are mundane and don't even matter, from what color pen to use and what color pencil and where to go grocery shopping. Most of them don't even matter. But about 1 or 2% of those are life-changing and life-altering. And most of those are split-second decisions. And as a result of COVID, the split-second decisions we've got to make literally maybe life and death for our family. Just keep in mind, this time last year, there are 138,000 people. 138,000 people who were still alive, who were planning their vacation and their life. Now we're in this COVID world, and the decisions you make for your family and for your businesses are absolutely key. Let me just pause. So outside of this COVID work, in my real life, obviously I am an ER doctor, but the bulk of my work comes from teaching executives and corporations and organizations how to make decisions. What we've been walking through here, just little mini lectures, just mini talks about how to go about doing it. Let me just say, the decisions you make about going to school is not going to be a split-second decision. Let me say that again. The decisions you're going to make about sending your child to school will likely not be a split-second decision. It will be an important one that's well thought out. It's going to go through a bunch of twists and turns as I'm about to send you through today. But again, I go back to my original point. You have the ultimate say-so about your kids going back to school or not, and the level of risk you're willing to assume. Let's say hi to a couple people. Dolores, Princess in Hampton, what's going on? Princess getting in Cleveland, Ohio. They're opening schools in September. Yeah, Dolores. They're opening school. Tara Jones, what's going on? They're opening schools in September. Again, there's not one easy answer here, and this thing's going to twist and turn many, many, many times. Oh, and by the way, just on a side note, many people reach out and ask me to live into your organizations, into your civic groups. Cool, I will help you out. But for those of you who have businesses, I will help you out. But reach out to me because if I'm live into your business, that's done differently. And we also do training as it relates to decision making. So hit me up, instant message me, drop me your email address in the comment section. If you want my company to come out and train, that's what we do, and we can throw in a COVID piece in there as well. Now here we go. Here's the newest data. Are you ready? Kim Leah, what's going on? Hey, Kim Leah. JM, what's going on? KT from New York. We got about 2 more minutes. Okay. We got about another minute. We need to get a few more people on board. But let me ask you a last question, then we would get started. I want you to think about this. Are you prepared to make life and death decisions for your family? Now think about it, seriously. Are you prepared to make life and death decisions for yourself? I'm not being dramatic. 135,000 deaths. Are you prepared to make life and death decisions for your family? Drop in the comment section. Give me a yes, no, not sure. One thing's for sure. If you wait until the important or split-second decision comes and then you try to figure it out, you're just guessing. Whereas if you train your mind, you're ready. All right, everyone. Hey, JM, what's going on? Hey, Dr. Rick, what's going on? Here we go. Let's just jump into it. I'm Dr. Geoffrey of Split Second Decisions, who has a bestseller out. It's called Train Your Mind, Split Second Decisions. I'll drop it in the link for you. I'll drop it in the comment section. The new data. Should your kids go back to school? Let me say I've started the first 3 off with this statement. The American Academy of Pediatrics strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in the school. Prior to yesterday's study coming out, there are multiple studies that pointed in a bunch of different directions. People who are in favor of children going back could use a bunch of good studies and support their case. People who are not in favor of children starting school could use a bunch of good studies and support their case. But this newest study, it's a game changer. And when I say game changer, I simply mean it's a new big data point that you have to consider. Before we get there, let me just walk through some of my basic data. If you listen to my last 3, I've thrown these points out throughout the way. Now you will just get them in a clear and concise way. And if you want to go back and listen to the shortened version of this, you can sign up for my YouTube channel at Dr. Geoffrey. Again, Dr. Geoffrey on YouTube. We're going to walk through 7 pieces of data. Real simple, seven pieces of data. In the search of the literature, looking at about 18 articles, I could not find a case where someone under the age of 10 transmitted the virus to someone else. I could not find one case. I said that to you in part 1 and part 2. We're going to come back to that. Yes, it is the case. Children are less likely to show symptoms. Children are less likely to show symptoms. We're going to define children in 2 categories. We're going to find children in 2 categories. And by the way, we're just going to define them this way for this live and for this study. Children will be from the ages of 0 to 10, 0 to 10, and then we'll do it from 10 to 17, 10 to 17, 17, 18, 19. All right, 10 to 17, 18, 19. So we have 2 groups. Clinically, as it relates to children when they get infected, children, ages 0 to 9, it is super rare. It is super rare once they get infected. It is super rare for them to develop significant symptoms. It's rare that happens, okay? Unless they have a pre-existing condition, which is not one that is known, that it's one that they already knew about prior to COVID. They're usually pretty big. I mean, it's a pretty big, significant health problem. Then children between the ages of 10 to 18, children between ages 10 to 18, it's rare for them to, once they become COVID positive, it's rare for them to develop significant sickness, unless 2 things: they have pre-existing conditions, or they are obese, or overweight, or obese. We talked about this in many lives ago. Being overweight and being obese are risk factors for negative outcome as it relates to COVID. And yes, they apply to children as well. You're saying, well, why didn't we know this earlier? Because most of our data early on came from Wuhan, China. They don't have the same obesity and overweight rates that we do. In this country, roughly half of the country is overweight. They don't have that, so we didn't know this data until the last couple of weeks. Obesity is a significant risk factor. Being overweight and obesity are significant risk factors for negative outcome as it relates to COVID, and that includes young people. Now, here's the newest data that we have to think about, and you can go to the CDC site and look at it. It's called CDC. You go to CDC. CDC. Contact tracing during COVID disease outbreak in South Korea 2020. You can go to the CDC site and look for it. This is the boom. This is the boom. The lowest rate of household transmissions of kids who go to school, but the lowest rates are in those 0 to 9. They're half as likely to transmit it as adults, half as likely. The highest household transmission rate is between the ages of 10 to 19. 10 to 19. In other words, if your kid is below 10 and they get infected and they come home, it's very unlikely that it's less likely they're going to transmit it to an adult. Whereas if you have a child between the ages of 10 and 19, there's a high rate of transmission. They come home and they pass it to other people within the household. The reason why that is a game changer is because we originally thought they don't transmit it, maybe not, and now it's been proven in this wonderful study. And then finally, in a survey in Wuhan and Shanghai, China, it showed that school closure and social distancing significantly reduced COVID-19 amongst contacts of school-age children. In other words, it showed that school closure, social distancing greatly, significantly decrease children getting infected and bringing it home and infecting family members. This study is a deal breaker. And the biggest question you have to ask is, who is your child coming home to? I mean, there's more of a communal question, but if you break it down to a family question, who is your child coming home to? So if you send your child to school, are they coming home to someone who has significant high risk factors? Significant high risk factors are the elderly, people with lung disease like asthma, COPD, people with heart disease, people with diabetes, people who are immunocompromised, people who are significantly overweight, obese. Is your child coming home to that high risk group of people? And I'm not saying the answer is yes, therefore your child stays home. Again, we're providing significant data points that it's up to you to weigh in. But this study, the reason why I had to do a live today, it's new and significant information, which is different than what we knew last Friday. In no way am I saying that, in no way am I trying to give an answer or suggesting an answer. Should your kids go back to school this fall? These are all data points for you to consider, but it should not be a split second decision. It should be a decision that everyone weighs in, thinks about, and walks through. And the final point, COVID will most likely kill, unfortunately, maybe 275, 300,000 Americans by the end of the year. We've got to do everything within our power to protect our families. And how we do that, it will be our decisions. I would just encourage you to work on your decisions and have a guiding theme. A guiding theme is, I'm going to protect my family at all costs. I'm going to minimize the risk in this area. But the three ways that we know, unlike the media has shared, well, the media has shared, unlike powers that be have shared, there's three things that are most important. Four if you're Black. One, social distancing is key. Wearing your mask is key. Washing your hands. And a great prevention for people of color or anyone, including the elderly, because they're known to be vitamin D deficient as well, is making sure you have appropriate vitamin D levels. But this is not a vitamin D talk, so we're not going to go off on that subject. But for more information on vitamin D, you can go to YouTube at Dr. Geoffrey. That is all the information that I have for you for today. But that's new and significant information. I was going to walk through the parts 1, 2, and 3, but you can go to YouTube and follow those. We will take questions today. Let's go back up here. Easy Rod, what's going on? Kim Thompson, what's going on? Mo, what's happening? Pam Williams, how are you? I have not heard from you, Pam. All right, here we go. Let's go up to these questions here. Hampton here. How the open schools in September? Kathy from New York. What's up, Kathy? Kim Leah, what's going on? Kim Leah's going to have a question. I'm sure about that. As Gigi, our Mrs. Carter Thurston asked, as a teacher, I wish I could make it so we did not go back with numbers going up. The other counties are going virtual. That's a great point. So you're approaching it from a teacher point of view. I agree with you. There are different counties that are doing it different. In Prince George's County, Maryland, they've just announced that the public schools are going to go virtual. Now, look, I'm going to tell you about some politics. Throughout my life, throughout my kids' education, and they go to Catholic schools, we've always followed what the public schools does. What we've always done. We may, except for days off or something, but if there's a snowstorm, boom, we're out. If there's a flood coming, boom, just listen to what the public schools are doing. Now, all of a sudden, because they've chosen not to go back to school this fall, all of a sudden the Catholic schools are saying, we will decide. What? That's politics going on there. All of a sudden, what? And I know it's a lot has to do with money. which is why I keep highlighting. You all think I'm just talking to you all, but I'm talking from my personal experience. It's up to you to be executives within your own family. And keep in mind, government officials would do what they do, schools would do what they do, but you are solely responsible for your family. I don't mean to like lecture, but I'm just sharing that with you. Eileen, what's going on? Oh, here we go. I miss somebody. Good morning, Rashima. Hey, Sandra Hicks received. Hey, Sandra Hicks says she received her book and she's reading. Great job. Hey, for those of you who are reading, please feel free to give negative feedback, positive feedback. But if you go on Amazon and put a comment, that would be great, especially how that Amazon algorithm works. Shantae Washington writes, I've been hearing of so many people contracting COVID who say that they did all the right things. Do you think that they are missing something? Yes. And now, mind you, I don't have any scientific studies, but what I do know is that there are a number of people who interact with like COVID patients regularly, and they don't get COVID. And so to hear that makes me think there's something that they miss. And often that one time of going out without your mask, being in the wrong place without a mask, touching something, and then touching your face. It just makes me wonder, because there's a group of the segment of the population that take care of COVID people all the time and they don't get COVID. So yes, Shante, I think it's something that they may be missing. Tara Jones writes, parents, just because school physically opens, don't feel pressure to send them if they don't feel comfortable. Make the best decision for your family. And Tara is a teacher of several years. So Tara, why don't you put a comment back down there and tell them your background. But Tara, that is very good practical advice. Kim Thompson, Stevens, Adrian Jones, what's going on? Adrian Jones, oh, doctor, I'm confused. 1 minute they say kids are safe. Then I see 200 kids under the age of 2 have tested positive for like COVID. So Adrian, cool. This is confusing. So don't feel abnormal. This is the whole reason why we started doing these lives and breaking it down to bare minimum information. Even the information that I presented today, if you go read the article, because of all the nuances, you may come up with like something different, as I see that the media has. But back to your point, it's confusing because it's not been rolled out well. In answer to your question about I'm confused, they say kids are safe. Then I see, yes, when they say kids are safe, it does not mean, everyone listen, it does not mean that they cannot contract COVID. Yes, kids can contract COVID. Kids can contract COVID. When they say safe, it means that once the child gets COVID and they're under the age of 10, it is extremely rare for them to develop significant symptoms, meaning that most of them stay home, they do just fine, and most of them don't even know that they have it. So that's the confusion. Just because kids do fine, it does not mean they do not contract COVID. Most of them are, in fact, asymptomatic carriers. Hopefully that helps, but that's not you. That's just how we have rolled this out. Right there with you, Jeff. Kim Thompson's right there with me. I appreciate that. Adrian Jones in Texas. Terry Jones. Teachers, see if your county offers accommodations for staff. Do a search on your school system website for the form. Great, especially if you're an older teacher, because what we have just found out is that these little cute little children we have are infectious. They pass it just as much as everyone else, except, hold on, if you have children between the ages of 0 and 9, they don't pass as much. But children between the ages 10 and 19, they're just infectious little students who are running around that school who can pass the virus to other people. That's very good advice, Tara. Tara says, Sandra, hi, Doc. I am well home since March. I am well taking vitamin C, D, E, B12, Centrum vitamin, women also. Oh, good. I'm good job. Good job, Sandra Williams. Very good job. Tara Jones, right. 25 years in education, Prince George's County school system. My system will be virtual until January. Yes, you will be. Gigi writes, so the kids in my elementary school can be carriers to me. Yes, Gigi, the kids in your elementary school can be carriers to you. And they transmit the virus at almost just as well. Those between the ages of 10 to 19 transmit the virus almost just as effectively as adults. But those between the ages of 0 and 9, it's rare that they transmit the virus. It's less likely. Let me say it. It's less likely. The reason why I changed that is because prior to reading yesterday's study, there was not, and looking at the literature, I could not find one case where someone under the age of 10 had transmitted the virus. Under this study that they did, that you go to the CDC site and see, it does happen. It's just not very often. Leslie says, hey, Doc, I'm scared. I'm just scared stiff of my child catching COVID. I am choosing virtual school for the semester. I don't think that's unreasonable. And I would encourage you all to talk to your employers because they are willing to make with you. And then, in fact, me uses it as self-serving. I would encourage you to talk to your employers about having a COVID expert maybe live in and just give an overall summary. Because I just did a big company recently. I found that most people, they don't have this concise understanding because if you just go to the media, it throws it off. But back to my point, reach out to me on Facebook, instant message me. I live into a number of like companies and it's about COVID, but most time it turns into a leadership talk about split second decisions as well. But for those of you who are choosing to stay home, I would highly encourage you to talk to your employers as well. Adrian Jones writes, so what do I think about this tryout vaccine that's coming out this month? I think I won't be trying it. Yeah, I won't be trying it. And I'm not an infectious disease doctor. I'm not a virologist or an epidemiologist. That was old. Nothing I say should be taken as medical advice, just information. What you just heard, my quick response was a father, a husband, and a son speaking, which is we're not taking in this family, and neither of my sister's kids, and so forth and so on. Kim Thompson writes, I'm curious, knowing what you know as a physician, what interactions are you allowing your kids to have with their friends, their goings and comings? If you don't mind sharing, I know you're directing them on all the protective protocols. So, Kim Thompson Stevenson, you can just put me on the spot. And let me just tell you why. I'm going to go full circle. Many of you all give me instant messages. You reach out, you call, and I appreciate that, but I encourage you to go back and listen to our lives because of the wrong information that they're getting. And so therefore, I encourage you all, anyone that you follow, it would be nice for them to have a license attached to their name. It doesn't have to be a doctor. It can be a physician assistant, a nurse practitioner, a nurse, psychologist, just someone with a license attached. Why? Because there's an expectation that there's certain things that they can't say. They just can't run off the mouth, or they shouldn't, but they also know there's a governing body that they have to answer to. The reason why I say that is because I'm about to answer that question, but it's not, I'm putting on my father hat. This is my father, husband, uncle hat. What am I allowing my kids to do? We did a bubble for a long time. And we've had to cut back. I mean, we've had to be a little more risky. Why? I've got a 14-year-old and a 17-year-old. What ended up happening was the first till about June, we just did it because Daddy said so. Boom, this is how we're getting down. After a while, as the world changed, their friends changed, as the friends' family changed, it was a more, that wasn't the best approach. We allowed our daughter to play softball. That was a big decision. We didn't allow her to practice at her games. We got the coach to adjust on a few tournaments. But not all the girls on the other teams wear masks. Our girls do. As relates to my son, which is what we pick and choose which friends can come over. but we let them come over. When they come in the house, it's only one friend, and it's usually a friend whose family we know. We ask them questions. Have you all been socially distant reasonably? Da, 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 da. The other day, my son had friends over. He had three. We knew the families very, very well. They were not allowed in the house. It was super hot, and they were allowed outside to play basketball. When they ate, they came into, they stayed outside, and they had a fan on. So these are all the accommodations. But one thing that I can tell you, the teenagers are a wild card. It's just a wild card. I noticed that you see them walking down the street. Some of these kids I know your mama told you to wear the mask. I have just not found these kids to be reliable. Hopefully that helps. But yes, I've definitely loosened up as relates to my daughter and my son. But they still wear a mask when they go out. When they go in stores, we still do our washing the hands, and we still socially distance when we're not in the house. And we do allow some people over. Hopefully that helps, but that was heartfelt. Nothing I say in that is medically proven. It's just how we've had to adjust in this household. Melanie Shorter, I'm a professor at my local university, and we are headed back in a couple of weeks. I am scared because college kids can be nasty as well. We are being supplied with masks and hand sanitizers, but that's about it. Any advice? Yes. I think that you can point them to the CDC website, and I believe I did this in the part 2, as a requirement, and I believe you will have unions as well. It should be an expectation that you all wear masks and the students wear a mask. And as the professor, you guys socially distance. Hey, y'all come on in, stay in the back. There's no coming up to ask questions, and anyone who doesn't wear a mask has to leave the class. It's that simple. But you keep your mask on, and I don't know how the class is set up, Melanie, but you're the leader of that class. You're the executive. You decide what's going on. The front row, no one sits there. Everyone's just in the back. Spread them out. That's how I recommend. But in your class, people have to wear a mask. Adrian, so doctor, my son went to Six Flags. He had a mask on, hand sanitizer with him. I told him he couldn't come home because he had to stay somewhere for 14 days. Do you think that was the right thing to do? Let me answer it this way. Six Flags is outside. It's hot out. Did you notice, pause, let me go back. Did you notice that when the protests first happened, we did not see a significant uptake in COVID deaths with the protests? The theory is because it was outside, many people had on masks, and COVID does not do as well in outside hot weather. As relates to your son, I would not make my son do that. And my son can go to Six Flags. I would let him go to Six Flags if I'm there or an adult's there to watch him, the social distance, wearing the mask. I think wearing the mask is absolutely key, and washing your hands. So your son, you know what he was doing and not doing. But it's not an easy call. It's not an easy call. And if you have any doubt, or there's high-risk people, I would encourage you, 14 days is what it is. Especially sounds like he's got someplace to go. I don't want you to think you're being unreasonable, because we are in different and difficult times now. And keep in mind, COVID, as you know, if you're young, you're probably pretty good. But it's what COVID does to the other folks. That's the issue. So, Mom, I think first commend you on showing that kind of leadership. And I don't think it's a right or wrong call. And in fact, in my book, Train Your Mind Split Second Decisions, it talks about that. Your decision, sometimes it's not a matter of being right or wrong. Sometimes you're just making the optimal decision with the information you have. Thank you for that question. Thank you. Before you come in, and he's 20 years old, Six Flags, check your gym. Okay, yeah, absolutely. Juan Lewis, what's the connection with zinc supplements and flu symptoms? People are saying it helps during a flu. I've not done any research. Thank you, Juan, for your question, but I've not done any research or reading on that. Nothing that I'm prepared to present, just because I couldn't find a randomized controlled study to really comment about it. And one thing I do tell our live crew is that Unless I tell you something different, any information I present is from CDC, WHO, Dr. Fauci, peer-reviewed journals, or listserv of physicians that I'm on. Very good question, though. And then finally, hey, these are strange times and these are scary times. I think as it relates to our kids, keeping them engaged and informed is absolutely key. Let me take a personal preference. So I'm one of the few people in the country who has, as it relates to the social protest issues going on, especially given that they're escalating. I've got a bestseller called Home Alive: 11 Steps for Surviving Encounters with the Police. It teaches boys how to make split-second decisions as it relates to interacting with the police. It's been out since March 2017. And then I have the new bestseller, which is the other bookend, Train Your Mind: Split-Second Decisions, to teach families, executives, and first responders how to make split seconds. I say that to say, while your kids are out of school, encourage them to read. The kids will not feel the Home Alive book. The parents will, but at least it gives you a platform for talking about those issues. Where was I going with this? The point is, we've got to do everything we can to maximize saving our lives in every single area and to maximize the decisions that we make, because COVID is going to be here for a moment. We can't allow COVID, the police, bad decisions, any of those to be the ones to take us out. And again, it's scary. I get it. Take a deep breath. In the end, 97% of us will do just fine. Your children, 99.9% of them will do just fine. Gotta be ready to move. Information changes. I would encourage you to find a reliable source and follow that source. What I would encourage you not to do, and I've talked about this several times, don't sit up and watch this on TV all day. It gets discouraging. Watch who you watch on social media. There's some people who just come up with stuff. Choose someone who you're going to rock with and limit the amount of time that you spend on this. All right, last couple questions, then we're going to go. All right, G writes, was there an article true about the bubonic plague and squirrel in Colorado? Yes, it was. Relax. The article, I don't know about that particular article, but yearly there's about 5 to 7 outbreaks of bubonic plague. Ooh, bubonic plague sounds real bad. It's caused by a microbe called Yersinia pestis. You see it in livestock, you see it in bats, and so we got small outbreaks every year. You simply catch them early, treat them with antibiotics, and they're just fine. It's just now it's heightened because of this contagion period we are in. But that outbreak is not abnormal. What's abnormal is that it's getting media attention. Hopefully that helps. They are sold out during the peak along with tissue. Thanks, Juan. Wonder how. Thoughts on school opening this fall? Wonder how. I appreciate the question. I would encourage you to go to my YouTube channel at Dr. Geoffrey, again at Dr. Geoffrey, and look at part 1, 2, 3, and 4. I provide a framework, significant data points as it relates to school openings. But what I do not do is say yes or no. Every situation, every family, every county is different. But I'll quickly tell you about the part 1 part is that as it relates to your community, wherever you live, there's what's going on in your community should play a role. And the way you assess that is the number of hospitalizations, the trend, well, that's up or down, the trend of ICU admissions, the trend of deaths, and then the positivity rate. The positivity rate are those who are tested, the ones who test positive. What is that trend? And that's why it's hard to give an answer to one person because it varies with where you live, what's going on. Is a hospital, do you have hospitals close close to you. And even those 4 data points that I gave you, if you don't have a hospital close to you, 200 miles away, it's still a data point. It just doesn't mean as much. So I would encourage you to follow me on YouTube at Dr. Geoffrey, and it gives you a summary of part 1, part 2, and part 3. Very good question. All right. Adrian Jones says, it's overwhelming. Adrian, relax. It's not overwhelming. It's overwhelming if you let it be. And I don't want to sound all mushy cushy, but it's a state of mind. It really is a state of mind. If you're overwhelmed, it's because you're allowing yourself to be overwhelmed. Did you notice? All right, I will be real. Do you notice I don't live as much as I used to? While people still need it just as much, and to try to keep up and live about it, it was too much. So I had to adjust that part. And so it's a matter of you making a mind shift. And by the way, in the book, I'm not being funny. In the book, Train Your Mind, Split Second Decisions, it talks about mindsets. It talks about mindsets and shifting your mindset and how you shift it. But yes, I will agree with you. It can be overwhelming if you let it. It can be scary. And sometimes you got to fall back on everything's going to be okay. I'll give you 2 reasons for that. For you, and by the way, if you're not religious, if you don't have a faith or God, this will do nothing for you. This will do nothing for you. Let me just say that right now. This is about having a faith. And let me give you an example. We've all been through something in our life where we weren't sure that we were going to make it or not, but we were doubtful, we were fearful, our faith was like lacking. And then we made it through. As example by the fact you're on this live right now. You made it through. So you got to lean on, hey, God's always looked out for me in the past. Now, for those of you all who don't have a faith, who don't have a God, I got something for you too. It's data. The data shows that 97% of us are going to do just fine. 97% of us are going to do just fine. And 99.9% of kids are going to do just fine. Okay? And then as it relates to the kids, whatever kind of parent you are, don't judge yourself on the decisions you make as relates to kids going to school. There's a lot of pieces in there. And for you parents who it's not an option for you to keep your kids at home, that's just is what it is. And full disclosure, when I found out that my kids, at first I was like, should kids go back? I wasn't sure. When I found out my kids were definitely not going back, I was relieved, but I was kind of like, ooh, they're home all day again for another 4 months. I work from home a lot, what you all know. So sometimes it's pressure having kids at home. So, it's just if many of y'all judge me, hey, come on, help me out, Adrian. Some of y'all, give me a few stars. If you give me a few thumbs up, hearts or something, if you're feeling what I'm saying. Some of you are going to leave me out there, but that's fine. That's fine. Hey, here we go. We're about to get out of here. None of y'all looked out. Kirsten Rose, what's going on? Here we go. Thank you all. Who's ever doing it, I appreciate it, because some of y'all left me out there. I see the stars now. Some of y'all left me out there like, what kind of father? I'm a good father. I'm saying right now. All right, Princess Anna said, thank God. All right, Veronica Henderson Guerrero. Good morning, Joff. Hey, how are you? Thanks for the regular updates. They're very helpful. My doctor informed me that there are many false negatives in testing because of user error, and there are different strands of COVID. I wouldn't call they're not different strands of COVID. Let me say it. There's not different strands of COVID. Okay, hold on. As it relates to this COVID-19, which comes from SARS-CoV-2. So SARS-CoV-2 is the virus. COVID-19 is the disease. Staying within that framework, there's only one form. Now, and credit to him, there's a bunch of different types of coronavirus that have been out for years. But back to this. As it relates to the testing for SARS-CoV-2, which causes the disease, COVID-19, yes, that test is only about 70% accurate. User error is a big part in just how the test is done. It's a reverse RNA test. But anyways, it's only about 70% accurate as relates to negative. So if they do the test correctly, that test is only about 70% accurate. And if it's negative, it's only about 70%. It's 70% correct. If it's positive, it's 99.9% accurate. Let's not get into the details, but a positive test tells you a lot. A negative test just says, we're 70% sure that you don't have COVID right now. And then it also depends on when you take the test. If I get exposed to COVID right now, and I take the test right now, it's going to be negative. So it depends on where you are on that. Hopefully that helps. Princess Rosemary, Rosemary, you can drop your kids out here anytime because you got good kids, and I know that you've been socially distanced. All right, and let me see. That was funny. Karen Freeman, 7%. That's a D. Hey, Karen Freeman must go to capital. Yes, it is. It's a D. But they're only 70% accurate. And quite frankly, I don't want to confuse this. I've not had an antigen COVID test. No one's offered it to me. No one's asked me to take it. I've had the antibody test. I had it last week. And unfortunately, it was negative. It was negative. The antibody test where they draw blood, that's the test you want to be positive. Mine was negative. Why? Because if that test is positive and you're alive and doing well, it simply means you were exposed to the virus at one point and your body developed antibodies to it. And antibodies are the antiviral killing cells. And it means that you're good for a period of time, just that no one knows how long. But again, we're gonna get off of here. But I would encourage you all. Don't forget, I live into companies. I do regular presentations to executives or organizations on decision making. What we've been talking about lately is we originally started talking about COVID. Then part 2 is about decision making. And then lately, because of my work with the Home Alive part, the whole social justice part, as well as the decision part, we go into organizations and talk about blind spots. Blind spots, it's a more comfortable way of talking about implicit bias. But blind spots. And in the book, there's a whole section on blind spots. Hey, everybody, we're about to get out of here right now. Adrian Jones says she needs the book. I'll drop the link in there for you. Boom. Karen Freeman, the link is in there now for you. Princess says thank you. Everybody put it in. I think it should have shared. And wonder how thoughts in school. Okay, got that. Everybody. The reason why you see me looking at 2 points is because on the StreamYard, it's a little bit behind. Wanda Laggy, what's going on? Hey, and then the final, what we always do. And this is key. For those of you who don't have a faith, it may not do anything for you, but since you're a community member, it should help as well. It is so important, especially during these difficult times, to do something nice for someone. You really think you're doing it for someone else, but it helps you more than anything. But the bilateral approach, I mean, the other helpful part is that it helps somebody. And when I say something nice, simply calling them. Choose 5 people who you've not spoken to in a while. Reach out, say hello. And in this period of time, I would even encourage you all to reach across the aisle. If there's someone black, white, purple, or green who you don't normally talk to, reach out and say, hey, I'm just calling to say what's going on. I got this thing, for those of you all who I know, I call everybody, all males, brother. What's up, brother? What's going on? And regularly, I'll get somebody who will indirectly say, well, I'm not your brother. And I say, well, I really mean brothers in God. And so I say it to say, reach out, do something kind for someone outside of your communities as well. Because how are we going to get through this together? Oh, and my last point. Ooh, all right, I have an article coming out. And it just talks about, this is just me. Follow me. My black, my white, my purple and green friends, follow me. Just like real quick. Have you all noticed that whenever there's a social justice issue, whoever the community that they're trying to direct, they send a messenger, so they may, if they want to get to people about voting, they'll send a star or an athlete. Da, da, da. I'm cool with that. That's how it works. But have you noticed, as it relates to medical issues in the Black community, especially as it relates to COVID, because we're knowing they're being disproportionately impacted. Where are the Black doctors? I know it's self-serving. I'm not talking about me, but where are the Black doctors on these national shows? It seems like there's been a decrease of them. If we're going to follow the principle that we want the target population, in order to impact the target population, the messenger needs to look like them. Let's stay consistent with that thing. But I've seen this switch. Just don't know what that's about. That was my own thing. Look, be nice, do something kind. And look, if you all not feel me on that, oh, look at the hearts. You all feel me. So it's not me. I thought it was me. Have you noticed that out there on these shows? And don't get me wrong, hey, I get it. But it's not one of those times you can say you got to earn your right. I know a number of Black doctors. Reach out to me. And so it just amazes me that in this period, especially with the social protests, that if you want to impact the population, you want to tell them to wear a mask and the importance of it, and washing your hands, and even deciding if your kids go to school. Put those people who look like the people who want to know on the screen. I just find it amazing. But hey, I don't lecture. I just see stuff. But back to our community, washing our hands, wearing our mask, and social distancing are absolutely key. And by the way, for those of you who have rocked with me this entire time, you now know enough where you can go out and be a super user, explaining to people what's going on, explaining to people the numbers, the rationale, because Madison Avenue has not changed. The concept has not changed. That's why, follow me. I know where I'm going. That's why mentoring is so important. People who look like you tend to listen to you more. Given that you know more information about this than the general population, take it back. Share, because people will listen to you because you're members of your community. Tara, Dolores, Gigi, Yolanda, we all have to go back and take it back. You don't have to be a doctor. You know a doctor who's been teaching you, who's been educating you. So you've got the skill set. Now we got to go out and spread it, and also reach out to the national shows and say, hey, where are the Black doctors? Because I know a bunch of them. That's it. Be kind. Sorry for that ramble. Victoria, true. Shante, I never thought about that. Thank you. Let the Black doctor speak. Hey, be safe. I will talk to you all soon, and have a great day.